right. Hello, everyone. Take my mask off here. Hi, I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. Today is Monday, March 8th. Here to give you our Monday Facebook Live update on the impact of the COVID-19 pandemic on Mobile County. That was also me. Got it, Mark? Okay, so we're good. We've got a lot to get to today, and just to remind you that this week we are going to transition back to giving our live updates on Mondays and Fridays. So we'll catch you up today on everything that's been happening over the weekend. So yesterday, just 12 cases of COVID-19 were reported to the health department. We did hear from one laboratory that their electronic processing didn't happen over the weekend, and they're going to redo it tonight, but it's only going to add about 15 cases to our count that have occurred over the last 3 or 4 days. So yesterday, 12 reported to us. On Saturday, 28, and on Friday, 70 cases were reported to us. 0 additional deaths were reported yesterday. Total number of deaths is 743. 9 additional hospitalizations were reported to us. That brings our cumulative number to 4,696. And the total number of people in the hospital yesterday with a COVID-19 diagnosis was less than 60, 59, though that was a slight increase from the day before. So 59 people in the hospital yesterday with COVID-19. So on Monday, we also released our weekly expanded report to give you, calculate rates in addition to just the percentages. And then we look at not just the report date for cases, but we also look at cases and deaths and hospitalizations by the infectious date. So again, just to remind you, last week, we've been seeing the numbers go steadily down, which is good news. Last week, just 309 cases were reported to us in 7 days ending Saturday. So that's really good news. We continue to see that. There'll be a little bit of a plateau probably because, it's unlikely that we will totally get to 0, but at some point we may see sort of a steady state. And we're still keeping an eye on how the circulating variants are going to impact our epidemiologic curve, because again, they are much more infectious. So as they begin sort of, coming into our community, we may see the number of cases rise slightly and not continue going down. Sorry, I got distracted over here. So just keep an eye. What we're hoping to do is, what we're hoping will happen is that enough people get vaccinated and continue wearing their masks and socially distance so that we don't see another peak caused by the presence of the variant and the variant becoming widespread, transmitted through widespread community transmission. But we'll see. Okay. So again, we usually also talk on Monday about the emergency department visits for COVID-like illness. That is down very low, it's less than 5% of all emergency department visits related to COVID-like illness. Our number of deaths have gone down last week. Just 5 people died last week with COVID-19. Of course, any death is a tragedy and unacceptable, but it is good to see that those numbers are going down finally. And then the percent positive test results for our statewide system, it's down to only 5% of the total tests conducted are positive for COVID-19. We are still seeing many more tests performed than our baseline, right? For a community our size, we need to see at least 2,000 tests completed each week so that the amount of testing doesn't really heavily impact our trends. And we're still seeing just over 5,000 tests performed weekly in our statewide surveillance system, and just 5% of those are positive. When I look at a couple of urgent cares who provide aggregate information in the community that do mostly rapid tests, they're seeing anywhere from 5 to 15% positive. but still much less than it was in December and January. We're still, as far as our school risk indicators, we still are seeing localized outbreaks. The number of cases puts us in the highest risk category. And the areas that we're doing good is we had a decrease in the number of cases reported in schools over the last 7 days. And the percent positive for that indicator is less than 7%, so that is moderate. So just keep that in mind, that we are still needing to protect our schools because of what's going on in our community. All right, so I think that's about all I need to say about that. I did mention last week we were talking about the numbers in Alabama. We did break that 500,000 mark over the weekend, where in Alabama today the dashboard is reporting on 500,092 cases and the number of deaths at 10,148. So this week is what we call week 52. The first case in Alabama, as we've discussed, was reported on March 13th. And this is the 52nd week past that date. So we will hit our 1-year anniversary this Saturday, and we have seen over 500,000 cases and more than 10,000 deaths in the 52 weeks since Alabama first got into the COVID-19 pandemic game. Not a game that we chose to be in, but here we are. Okay, some good news on the horizon, I hope. Let's see, just wanted to remind you that Alabama is averaging around 100,000 doses, 100 to 110,000 doses of vaccine shipped to Alabama each week. So to date, there have been just over 1 million vaccine doses administered, and there are more than 1,100 providers enrolled to give vaccine. So this is good news. And lots of people have been asking me, how is the J&J going to be used? And Alabama announced today that, around 40,000 doses have been strategically placed throughout the state with providers to leverage the current infrastructure. So again, you have to have the capacity to store the vaccine and have a plan for administering it. And then there are additional providers that are still not receiving allotments of vaccine, and the state is continuing to work on those to sort of try to determine how they can get vaccine to as many providers as possible. All right, let's see. So CDC made an important announcement today. This morning it's just come out, so I haven't memorized it yet, but hang with me. The title of the news release was CDC issues first set of guidelines on how fully vaccinated people can visit safely with others. So this term, fully vaccinated people, is becoming lingo. I'm very glad to be a fully vaccinated person. Basically, if you're at least 2 weeks past your full course of vaccine. So if you got Pfizer or Moderna, if you are 14 days past your second dose, or if you got the J&J vaccine and you're 14 days past that dose, then you fall into this prestigious fully vaccinated people group. And again, there are just a small proportion of the people who've been able to receive the vaccine because they were in those eligibility groups. We know that we need a lot more vaccine to get everyone who should have a vaccine and who wants a vaccine to get them vaccinated. But here's what CDC said, sort of understanding what they are learning about immunization achieved through vaccination, right, and sort of a growing body of evidence. CDC has said that fully vaccinated people can do this: visit with other fully vaccinated people indoors without wearing masks or staying 6 feet apart. So that is good news, particularly if you have, let's say, a coworker and you're both fully vaccinated. If you are indoors, then you don't have to wear a mask or stay 6 feet apart. Okay. You can also visit with unvaccinated people from one other household indoors without wearing a mask or staying 6 feet apart if everyone in that other household is at low risk for severe disease. So for me, that means if I'm fully vaccinated, I can go into a household where not everyone is fully vaccinated as long as no one in that household is at risk for severe disease. So I would not, for example, want to go into a household with a mix of vaccine and fully vaccinated and not fully vaccinated if there was someone over the age of 75 in the home, or if there was, someone there who wasn't vaccinated and they were at risk of severe disease because of underlying medical conditions, for example. All right, and here's the third thing that you can do if you are a fully vaccinated person. You can refrain from quarantine and testing as long as you don't have symptoms after you've been exposed. So since I'm fully vaccinated, if I'm around someone that has COVID, as long as I don't develop symptoms, I don't have to quarantine. Right? Good news. So those three things: visit with other fully vaccinated people indoors, visit with unvaccinated people in one household as long as no one there is at risk of severe disease, and I don't have to quarantine or be tested as long as I'm asymptomatic following exposure with someone who has COVID. Now, just to clarify, this applies to non-healthcare settings. Okay, non-healthcare settings. CDC has not, they're working with CMS to get this version, these guidelines, decided and published for healthcare settings. We have a lot of nursing homes who have, residents are vaccinated, staff are vaccinated, and so, what I just announced applies to non-healthcare settings. And keep eyes peeled. By Friday, we should have the information on what people who are fully vaccinated who reside or work in healthcare settings are allowed to do. So, good news. If you've been paying attention, then, for when you have natural immunity, so if you have COVID and you develop natural immunity, we still say within 3 months after your infection, you don't have to quarantine. And last week that we said the same thing for people who'd been vaccinated. But now they've lifted the 90-day time period for people who've achieved immunity through vaccination. The 90 days still applies to people who have some presumed level of natural immunity following an infection. It's a little tricky, but we'll all get it together. Okay, I'm going to wait on that. So a couple of questions. Let's see. Media's noticed that some restaurants were extremely busy this weekend. Are there concerns about spread of COVID since this was the first weekend with some relaxed safety requirements for restaurants? So yes, again, the single thing the biggest thing that was relaxed is that there is no limit on the size of party at a table. So if you are a party of 9 or 10 or 12, then you may be seated at a restaurant. So yeah, I'm always concerned about increased risk of transmission, particularly in bars and restaurants, because it's an environment where people are closer together and you have to take your mask off to eat or drink. And that puts you at higher risk of COVID transmission. So yes, it does worry me somewhat when I enter a busy restaurant and I don't see people wearing, a well-fitted mask. That definitely increases your risk of catching COVID or transmitting COVID if you are in a restaurant where there is not, where you're in close quarters, you're not able to maintain 6-foot distance and you go long periods of time without your mask. All right, someone asking how the vaccination effort is going. So for now, there are not county level data available on vaccine in Alabama. The state health department has been working on that. Lots of counties are asking for it. I suspect we may see it sometime this week on the dashboard hub, but right now, county level data on vaccine is how much has been administered is not available yet. Now, lots of people also ask me who's got J&J vaccine, who's got Pfizer vaccine, where can I get vaccinated, or find out where I can get vaccinated. So there are really two locations. well, 3 actually. So you can always visit mchdcares.com to get information on what the health department is doing. And then the Alabama Public Health.gov website has a map there on places in Mobile that has been approved and has received at least one shipment of COVID vaccine. But one of the places that now is come on board that I think will be the most helpful going forward is vaccinefinder.org. Right now, mostly vaccinefinder.org for Mobile is populated with pharmacies, but there are a lot of them that have some vaccine. And that website also tells you if they have doses available or if they are out of stock, which is a really big help because the state health department website doesn't contain that information yet. So if you want to know, how many pharmacies in the Mobile area have J&J vaccine because you only want to get one dose, then you can go to vaccinefinder.org and look for that. Okay. Someone commenting on Facebook that Mississippi has lowered their age for receiving the vaccine. Yes, they have lowered the age eligibility for receiving the vaccine in Mississippi. I don't know of any plans for Alabama to move to open eligibility any further at this time. And I'm not the one that makes that decision. That decision is made at the state health department. So we will continue to monitor and follow their lead with regard to the eligibility requirements. Sometimes they also lifted their mask mandate, and we didn't do that. So I know those of you that live on the border, there's really no. It's not like there's a moat between us and Mississippi. There's just so much movement back and forth. But I have not heard that Alabama has any plans to expand eligibility requirements for COVID vaccine at this point. All right. Someone asking, how long does the vaccine last? Is it good for a year? So I can't answer this question because it's not been a year since we've had vaccine. It's only been a few months. And even the clinical trials that started last year, many of the people who were in the clinical trials have not even made it a year yet. So it's just going to take some time for us to learn how long we'll have immunity due to the vaccine. But I think, early indications are good for CDC to take this approach for fully vaccinated people. I think that's a really good sign that they have confidence in the level of immunity that these vaccines provide. They have confidence in their safety. And I think we're seeing, them make this move because they even have, growing evidence to show that the vaccine is good against the variants. So that's really good news. All right. Then we got a question about someone had a family member who got their first dose at a clinic, but when they came due for their second dose, the clinic said they didn't have any vaccine. And lots of people are scrambling around the state to deal with this. So yes, there was a system, a clinic, who I think they have probably 15 or more than 15 clinics throughout the state. And in many of their locations, they did not receive or did not have available the second doses to vaccinate the patients or the people who received their first dose there. The state health department has been working closely with them. We have been talking with the state health department, about whether or not there's a role for us. Right now, it's looking like the state health department has worked out a solution to provide vaccine directly to this clinic. So while just stay in close communication with the place you got your first dose, that is your best opportunity for getting your second dose. So it's not going to be exactly at 28 days, but just remember that it doesn't have to be at 28 days. It could be 38 days, 50 days, 60 days. So I realize that this is a cause for concern for a lot of people who want to complete that second dose, complete that series so that they can be fully vaccinated. But if it doesn't happen at exactly 4 weeks, you'll still be okay. So I believe that the state will be able to get vaccine to this clinic so that they can get those second doses in arms. All right. Two more things. Do you have questions?
Do we have any idea when Alabama might hit herd immunity?
Okay. Sorry, I've got lipstick on my mouth. Okay. So herd immunity is this elusive thing that, originally we had said maybe you needed to be at 70%, 70% of the population vaccinated so that you would have herd immunity. With these variants and looking at the way that things are going in the community with vaccine, now I'm hearing probably, at least 75, maybe 80% vaccine coverage is what we need. Right now, I believe the statewide overall, again, the county level data is not published, but I believe overall we're nearing 20% having at least their first dose. So we still have a ways to go. And remember that the current vaccines are only authorized. The Pfizer vaccine is authorized for 16 and older, and the other vaccines, the J&J and the Moderna, are authorized for 18 and over. And I saw some press over the weekend that said it might be next winter before we have a vaccine for children. So that's a large part of our population that's not even eligible for the vaccine right now. So it's going to take us some time before we get to that herd immunity.
How many healthcare workers have received the COVID vaccine in Mobile County?
So the question is, how many healthcare workers have been vaccinated in Mobile County? And I don't know the answer to that question. What we heard early on from the hospitals and from nursing homes and long-term care facilities and assisted living is that less than half of their employees were getting vaccinated. But, ongoing conversations have really, we're seeing sort of people changing their mind about wanting to take the vaccine. They've seen that it's safe. They've seen, what fully vaccinated people can do, and they want now to get vaccinated. So we're really hopeful that a much higher percentage of employees of healthcare providers will take the vaccine as we, get more and more and more doses in arms. I was on a call today and they were talking about pregnancy. During the clinical trials, pregnant women were not enrolled, although a few of them did conceive during the clinical trial. So there was just very minimal information on vaccine in pregnancy. And CDC said today that VSafe app that they've been using to monitor sort of a volunteer monitoring, that they had over 44,000 people enrolled in VSafe who had been vaccinated and are now pregnant. So they're able to get a lot of really good information on the safety of the vaccine in pregnant women. So please, if you're a pregnant woman, you've been vaccinated, and you have been providing information to VSafe, please continue doing that. It's important. Okay, so exciting news for us. Mobile County Health Department will be hosting a first dose messenger RNA vaccine clinic, the Moderna vaccine, Wednesday, March 10th at the Alabama Cruise Terminal at 201 South Water Street. And again, the people eligible, bring your proof, bring your ID or your badge or your business card. People 65 of age and older, frontline workers, so healthcare providers, first responders, hospital-based occupations, state of Alabama continuity of government strategy, so legislators, courts, judges, constitutional officers, and cabinet heads, corrections officers, food and agricultural workers, postal service workers, manufacturing, grocery stores, public transit, people who work in education, child care, and the judiciary system. So that is still the eligibility. First dose, Moderna, first come, first serve, no appointments. Bring your eligibility. Starts at 9 o'clock and closes when we run out of vaccine. So that is good news. If you meet those eligibility requirements and want to get vaccinated, please come see us at the cruise terminal on Wednesday. All right. I think that's it. I was going to talk. Oh, yeah. Sorry. Thanks, Mark. Okay. I've been wanting to do this from some time, so I have to do it now since we don't do Facebook every day. I want to talk a little bit about a well-fitted mask. CDC released a report a couple of weeks ago, and for some reason, the message when it was socialized, it got kind of translated in the wrong way. So everyone thought that CDC was saying you needed to wear 2 masks, and that's not what they were trying to say. What you need is a well-fitted, 2 or 3 ply mask that's properly worn. All right, so let's talk a little bit about this. So here is, a mask. I'll fit it over my ears, right? This is not a well-fitted mask. It has the ear loops are sort of too big for me, right? So there's places for respiratory droplets to escape under here. It doesn't fit well under my nose. You can tell that it's got some play in it because when I breathe in, so does the mask. So this is not a well-fitted mask. Now there are some things I might be able to do to help it, right? But I have to be careful because if I make it shorter for me so that it fits tighter over my nose and chin, now I create this problem where I have a hole where respiratory droplets can escape on the side. So that is not a well-fitted mask. This one is better. Okay, it fits over my ears well. It fits over my nose and under my chin, and I don't have a lot of places for air to escape. It still can come out here, right? If you're fogging up your glasses, then it's, air and respiratory viruses can escape. But this one fits pretty well. It fits my face fairly well. I can just tell that I have some play up here. So what I might want to do to kind of help, this place is maybe wear a thinner paper mask that has a nose, has a little piece of metal here so that I can bend it over my nose. And now I've stopped that problem, right? So I still, most of my protection's coming from the first mask that I'm wearing, but because this thinner one has a nose piece, now I can really make it where I'd have less air and less respiratory droplets escaping through the top, right? But don't just wear 2 masks because you think CDC said that. There are some other versions, right? This is one of the classic sort of K95s. This is really nice because, again, it has this piece of metal here. You need to make sure that you press it down so that nothing escapes. This is really ideal for my face because I've got sort of protection all around, underneath, and on top. The one that I like to wear, which is this hand sewn mask, it also has good coverage over the nose and under the chin, right? So it doesn't poke out on the sides. It doesn't have a metal clip, but it's got this piece that's kind of shaped like my nose so that it reduces the air that comes out. Now remember, if this were too big for me and I wanted to, turn it over so that it fit closer to my face, look, now I'm creating another bad situation, right? So it's not that 2 masks is right or wrong. It's just about wearing a well-fitted mask. So please, just think about that when you're out and about. It's not always just about wearing 2 masks or 3 masks. It's about wearing one that fits your face well so that you get protection. All right, unless there's something else for today. Okay, that's enough for today, isn't it? All right, so maybe we'll see you on Wednesday at the cruise terminal for your first dose of Moderna vaccine, and that would be great if we do. And if not, we'll catch up with you again on Friday at 2:30. So everyone have a great week.